member for Edmonton Calder.
Thank you, Mr. Speaker. Over the past year, this government has presided over a healthcare system that Albertans and health workers continue to lose faith in. When doctors are being bullied and intimidated for advocating on behalf of their patients, they have a health minister that blows off these concerns as a mere workplace disagreement filled with rumours and innuendo. Now a new crisis is emerging with cancer testing under this health minister's watch. Given Alberta Health Services has been warned about the rapid changes affecting pathology practices in Alberta since this summer, what has the health minister done to fix the problem?
The Honourable Minister.
Well, Mr. Speaker, there are a number of things there. I guess, first of all, I would be the first to say I do not believe that we have a crisis in pathology testing in this province, and I hope that all Albertans would take note of that. Alarming the public is the last thing I believe that we should be doing. With respect to what's being done about the concerns that have been raised both in Calgary and in Edmonton at the Royal Alexandra Hospital, Alberta Health Services has asked for a review, a quality assurance review by the Health Quality Council, which is currently underway. I have every confidence it will give us the information we need.
Thank you, Mr. Speaker. Given that under this health minister, the Health Quality Council has now announced 2 reviews of the handling of cancer testing at the Rocky View and now the Royal Alec, will the health minister admit that there's a problem with pathology testing in this problem and the lives of cancer patients could be at risk?
The Honourable Minister.
Mr. Speaker, the 2 situations are entirely different, as I think the Honourable Member knows. The question surrounding the procedures at Calgary Lab Services have to do with the processing of anatomical pathology specimens in the laboratory. The review that's underway at the Royal Alexandra Hospital has to do with the possible misreads of a number of samples by one pathologist in a fixed period of time, and that pathologist is no longer practicing with Alberta.
The Honourable Member, please.
Given that this government ignored the warnings about closing the Tom Baker Cancer Lab for the last 2 years, will the health minister continue to ignore the concerns of health professionals in this province, or will he finally admit that there's only one way to stop crisis after crisis in our health care system and call a judge-led inquiry?
The Honourable Minister.
Mr. Speaker, once again, I don't want Albertans to get the impression as a result of this exchange that this government believes there is any crisis in pathology testing in Alberta. What I would say is that for this honourable member and for any other member of this House that is in possession of information that they think is relevant to this review, I would urge that member to contact the Health Quality Council without delay and support the process underway.
The Honourable Member for Edmonton Calder, followed by the Honourable Member for Calgary McCall.
Thank you very much, Mr. Speaker. So in keeping with the theme